Evidence about the safety and effectiveness of COVID-19 vaccination during pregnancy has been growing, and here to tell us more is Women's Health Service physician Dr. Nika Vizcarra from Intermountain Healthcare, the sponsors of this segment. Welcome, Dr. Vizcarra. Thank you for being here. So many questions about pregnancy and vaccinations. What can you tell me? Are you seeing a difference in COVID infection rates between vaccinated and unvaccinated women?
Yes, well, firstly, thank you so much for having me here. I'm very excited to be here to talk about this important topic today. Regarding your question, there absolutely is a difference, especially when we're talking about COVID infection with that leads to in-house or hospitalization and ICU admission. We actually have seen through the CDC cases reported that symptomatic patients with COVID-19 infections who are pregnant have a threefold increase in risk of intensive care unit admission or ICU admission, which includes ventilation support, as well as a 70% increased risk of death when compared to non-pregnant patients.
Now, I know a lot of women are very concerned, especially in that first trimester, of just doing everything right, because you know, that's a very cautious time for a lot of women. Is it better to perhaps wait until the second trimester or to get a vaccination if that's something you're interested in, or should you just do it as soon as you can?
That's a really excellent question. So basically, through all of the evidence regarding the safety and effectiveness of vaccines, of COVID vaccines specifically in pregnancy, we found that the known benefits of vaccination in pregnancy far outweigh the potential risks of vaccination in pregnancy, so we recommend it. And we recommend the primary treatment or primary vaccination in all stages of pregnancy.
Let's talk about boosters. The big topic of conversation right now, a lot of people are looking to get their booster shots for pregnant women. Same thing, should they wait until they feel like they're in a safe zone, or just as soon as you're eligible for it, go for it?
I would say just as soon as you're eligible, go for it. The boosters are just as safe and effective, and also even past the known regular complications of COVID-19, like the ICU admission, like I mentioned before, there's also pregnancy-related complications that are increased with infection, and those things are like hypertensive disorders of pregnancy, such as preeclampsia, as well as preterm birth, neonatal or newborn admission into the neonatal ICU because of COVID-19 infection, and stillbirth.
That is some really good information. I think the bottom line is there are a lot more benefits to getting the vaccine than not getting it. Thank you for your time, and thank you to Intermountain Healthcare for sponsoring this segment. For more information, visit intermountainhealthcare.org/Nevada. Jillian.